Welcome to the Bucket Plan on Demand, a podcast for financial advisors based on the best-selling book and process that simplifies financial planning. Hear from skilled industry professionals and special guests each episode that will help perfect your approach with clients and your results.
Hi, I'm Kirsten Schlumbohm, Vice President and Head of Annuity Sales here at C2P. Welcome to Bucket Plan on Demand. We're going to be speaking with Bill Cohen, guiding clients the realities of caregiving. I'm super excited. I met Bill about 2 years ago when I was going through the start of my own personal journey on this topic. And Bill is the founder of Cohen Caregiving Support Consultants, where he provides guidance, education, and emotional support to family caregivers of loved ones living with Alzheimer's and dementia. Drawing from his own decade-long experience caring for his late mother, Bill helps families navigate the complex world of caregiving, covering everything from elder law and financial matters to housing, hospice, and long-distance care. A trained elder mediator, speaker, and facilitator, Bill works collaboratively with care teams and senior services providers to reduce stress, build understanding, empower caregivers with practical, compassionate strategies for every stage of the journey. Welcome, Bill. I'm so glad to see you here today.
Thank you. It's an honor to be with you again.
Yes, and we get to represent the Pacific Northwest, and I love it. I love that you're in my own backyard. But let's get down to it, because this is a topic we're talking about quite a bit. Next month is long-term care awareness, but we also have to put our own oxygen masks on first as we plan for events or we're taking care of our families. So you've transformed your personal caregiving experience into a mission to support others. How can we as financial advisors better recognize when a client is beginning to take on a caregiving role, even before the client says it outright? Are there any signs we should be looking for?
I think the first word is listen for signs, listen for indications, because some people may not come out with it outright. They may be talking about their own situation, and then someone, yeah, but I just can't make a decision right now, or I don't know what to do. Mom is showing some disturbing signs. I don't know what's going on or how to handle it. I feel alone and lost. I need to get her to a doctor and probably make some plans, but I don't know where to start. So it's things like that, and just ask open-ended questions and say, tell me a little bit about that. But also it can be like, besides listening, but anything regarding family matters, some illnesses, anything. They could be little words that pop up, give an indication, because as a financial advisor, you would be doing a disservice to them by not discussing it further, because they may be getting blindsided. They may have no idea what the costs are when it comes to long-term care, when it comes to diseases like any form of dementia.
It's overwhelming when you learn about it as a family member, as a child to a parent who has it. And sometimes somebody asking the right questions opens up that vulnerable conversation that needs to be had, because I could speak from my own experience. I'm thinking about what would I do, or what am I going to do in 30 years when I'm my mom's age and I'm going to need help and care. Advisors may hesitate to bring up aging or cognitive decline just because it is so personal. And it is one thing that you have to get vulnerable with your clients with. How can they approach these sensitive topics with care, professionalism, and empathy?
I think, again, it goes back to listening and open-ended questions. But as a former financial advisor myself in a past life, it's important to cover everything, do a comprehensive fact-finding, or whatever term you want to, inventory. What do you have? What are your concerns? What are your goals? That type of thing. But do you have some problems that I should know about? Things that you've been meaning to ask about. One of them could be long-term care insurance. And it's different than it used to be. If you have an older client, a lot of them had those plans. They were easier to get. They were more affordable, better benefits. And that has changed quite a bit. There are fewer carriers, and it's gotten very expensive. But if somebody has that and you find it out, that's going to answer a lot of the questions. So I think it's, again, doing the total job, asking the right questions, and doing a little fact-finding, and without actually using words like, does somebody in the family have dementia? That's going to scare people off. I know at least twice in my journey with my mom, I was in denial. Like, what's going on with her? Oh, she's just getting older. She's tired. She was in the caregiving role for my late stepfather. And we said, maybe she'll bounce back. So we'll see. But obviously that didn't happen. It turned out later she had Alzheimer's.
It's challenging because it's so personal when it happens to you and your family. Mm-hmm. And when I was in the advisor chair, I talked with my parents or spoke with my parents about long-term care insurance, but they had a very adverse reaction to it because my grandfather passed away in a nursing home. But care today is not the same as it was in the early 80s. It's much more advanced. But we still have people who want to age in place. They want to be at home. So in our past conversations, you talked about creating a care team, not just for our mother, our father, our spouse, but for the caregiver. Because if we are going to take on that role as caregiver, we have to put our own oxygen mask on first. Mm-hmm. How can we, or what can we do to help clients build and document that support system, whether they're receiving the care or the caregiver?
Mm-hmm. I'm going to give a quick little story about that. I remember a while back, somebody who was in the in-home healthcare field was talking to one of their case managers, and she says, "Do you ever refer anybody to Bill Cohen, caregiving support?" And they said, "Oh, he does what we do." No, he doesn't. Look in your file. People need resources. They need a team. They need support. And we only take care of one piece of that. And if she had looked, that case manager, the person who asked, knew what the story was, she would have known that, she can help, that Bill can help support the caregiver as well as helping take care of the person needing the care. And so it's really important that whether it's elder law or an in-home care, housing advisor, realtor, anything like that, putting together that care team you're doing the total job. And that's as a certified senior advisor, and most of you in the industry, whether you have that designation or not, CFP, CHFC, any of those, to take that holistic approach, put together the team. There's a term in social work called wraparound, where they do it usually with kids, but bringing everybody on the team, that's important for getting that kid back on track. Well, that's the approach I try to take. So,
in another podcast I had with an author of a book who did When Women Get Sick, she talked about creating your squad. Can you kind of go deeper into how to help our advisors help their clients develop their own caregiving squad or that team to support them when they face this?
Well, I think most of us do networking in various ways, whether it's your chamber or BNI or financial things, my case, senior care. I think we want to put together our A team. Who are the best advisors who, when we have a client, who do we plug in there? So who do they need to talk to? And that's what goes back to my previous story. That person was not thinking, who else does our client need to talk to? And that's where I like to come in. And I like to say, I don't compete with anyone. I collaborate with everyone. I partner with everyone. And whether it's housing or elder law, what have you, I say, okay, you need to talk to one of these 2 or 3 people. And that's doing the complete job. And that's what the clients need. Because again, they feel alone. They feel lost. They feel abandoned. I think one of the examples I like to use is, in a lot of cases, when it comes to chronic illnesses and diseases, the doctor gives a diagnosis. They give you a care plan. They give you a pamphlet even. With dementia, most of the time it's, if you even get a diagnosis, where do you go from there? Caregivers, and this is the way I feel lost. They feel abandoned. That where's the plan? Where's the treatment? It's not there. And so what I try to do is fill that gap. And who's saying to the caregiver, how are you doing? Right? We're looking at the person who has the disease, in this case, dementia, but who's caring for the caregiver?
And that's so vital, because if you aren't taking care of yourself as the caregiver and you're not able to transfer the title into a care supervisor because you don't have the right plan in place, it's hard to put your own oxygen mask on first. So I know one thing that you've done really well and you helped me with when everything happened with my parents was self-care is not selfish. It's vital.
Vital.
How can advisors or family members help caregivers balance financial responsibilities with their own well-being? Because it's so vital. Again, if I'm not taking care of myself, what good am I to my family?
Well, I think a lot of times, even when you're talking, not just with somebody with dementia, it's not a bad idea to avoid yes or no questions, but which one or yes, which choice? Because if they say, how are you feeling? Oh, I'm fine. I can get through this. Instead of saying, are you in a support group? Have you seen a counselor? Are you getting exercise? Are you getting enough sleep? Are you eating well? Things like that. Those are things that I learned were very important to me. I think I told you a massage, a regular massage became not a luxury, but a necessity. And still to this day, even after my caregiving, because, we all deal with different kinds of stress. So that was mine, to get away from the desk, go out for a walk. I was in a support group. I saw a counselor. These things were very important, or else, because I was holding down a job, 45 minutes south of where I live, and mom was about 15, 20 minutes north, and juggling the two, the work life balance. And I'd like to say, by the way, she was on the East Coast after losing her home in Hurricane Katrina, and long distance caregiving is one issue. The same city is another. It's not harder or easy. It's just different, but it's always on your mind. And it's a physical stress. It's a mental stress, psychological. And yeah, we have to take those steps, and people need to be supported. Now, a financial advisor could be one of those first lines of defense, so to speak, that they talk to, and maybe even before the doctor. I'll do the best I can, take care of them. The doctor may not even tell them. A lot of times they don't give a diagnosis because they don't want to offend their client.
Right.
Or say you shouldn't be driving anymore. They don't want to make their client angry. So that's important that we take care of that.
Well, as financial advisors, we become trusted advisors, not just on their finances. A lot of times we do a lot of conversations. We have a lot of connectivity with our clients. And so they do feel comfortable sharing with us. I just put my mom in long-term memory care facility, and then we can open up that conversation. But I love the fact, because how are you has been a greeting. A lot of times people are like, how are you? It's not a question, it's a greeting. So taking that time to say, Bill, how are you? I know you're dealing with a lot. What can I do to support you? That's not only sometimes tough to ask because you don't want to be intrusive, but it's also tough to answer because I can say from personal experience, hard to just say, all this is going on. I'm not sure which way to go because I'm so used to being independent. So it's building that trust and that rapport and asking a question where they feel the authentic, how are you? Come out.
Right. Say it with sincerity.
Yes. And I get it. Everybody's going through something, but together, if we can tune into, I see that you're going through something, Bill. How can I support you? What do you need? And come from a place of empathy and vulnerability, you'll be able to we can do a better job of taking care of each other. Yeah. From a financial planning standpoint, what are some financial gaps that you're seeing when you're talking with families that they're facing long-term care or memory care needs?
I think it's partly that they have no clue how much that's going to cost. Whether they're at home with in-home care or having to go into a care community, even independent living, on up to assisted and memory care. Memory care is over $10,000 a month nowadays. Not too many people are financially well off enough to handle that on their own. And if they don't have long-term care, hopefully they've planned enough for not just retirement, but for illnesses and stuff. I always remember the financial partner when we were still about maybe 10, 12 years away from retiring, maybe even shorter. He says, you're in good shape, but keep putting away money into your deferred comp because you're going to have those extra expenses, especially medical. And it has happened. I've had the cataract surgery and I've gotten a crown or two or an implant. So things happen. And as we grow older, we know that you have to be prepared for that. What you know it and I know it. What percent of the country, I don't know the figure, you may know one, are one medical emergency away from bankruptcy.
Yeah.
I think it's like 2/3 or something. I may be wrong.
I'd have to research it because if I say a quote, my compliance team will want to know where I got it. So I'm not going to answer that. But
I
it's a
understand.
big number. And it
Yes,
is
it
something that
is.
we should be very cognizant of as we're working with
Mhm.
our clients, especially if we're heading towards retirement and we need to do like a Medicare bridge
Mhm.
or healthcare bridge to make
Right.
sure that they
And
can
we
have.
know that unfortunately things are getting even tougher in the health industry, Medicare, Medicaid. And so it's hard. How can you plan when you have that much uncertainty? And where health carriers are cutting back on benefits, they're raising premiums, uh, dropping coverage in certain areas or counties, and it's scary out there. And I don't know how people handle it. I don't
It's challenging. And
know.
as from the financial advisor seat, a lot of times we're going to focus on the person needing care. And that's right or wrong, it's what we do. We always are concerned with the person needing care. And in a husband wife scenario, a lot of times it's the wife taking care of the husband, or vice versa, or taking care of a spouse or parent. How can we ensure that the caregiver's financial health doesn't fall through the cracks? Because, the first thing that happens is when we start taking care of a loved one
Mhm.
in crisis, we put ourselves in the back seat. So how do we help them help themselves so they don't fall through the cracks for their own
Mhm.
financial health?
Yeah, that's a real tough one. I think it's the planning and being proactive and not reacting in a crisis, because we know you have fewer choices and it's emotional and it's stressful. So I think just ask those questions and help them look at the big picture, be holistic. I was saying earlier,
And
and ask them, have you looked at in the case of dementia, have you looked at the Alzheimer's Association, alz.org? There's a lot of good information on there, resources about care and uh, financial options and support groups, and do the research that's been happening, what medications are out there. So educate yourself. But yeah, go to a support group. Would be encourage them to go to a support group. Some are online, some are in person. I started doing support groups online during the pandemic, and it just expanded where I'm helping people all over North America, US and Canada. And that's important. Uh, they feel they need the support, and they feel they don't want to be abandoned. So since the pandemic ended, one of my groups, which is weekly, we alternate between in person and on Zoom, because we don't want to leave out the people who are joining us from everywhere. We have people joining us from New England to Hawaii. So
I think from an advisor point of view, one thing we can do is have the conversation. If I'm working with the parents and they're like, "Hey, we're putting this plan in place," we
mhm,
should ask, "Well, may we meet with your children with you to talk
mhm,
with them about your care plan?" And then ask them about the questions of, "Would you rather be a caregiver or care supervisor for for your own husband, wife, and for your parents?" And help
mhm,
them develop a plan together. Because
mhm,
at the end of the day, if we can help a person not just be a caregiver for their spouse or their parent, but be a care supervisor so they're not taking on the burden, and
mhm,
their parents can get the same kind of care as they're either aging in place or going into a facility that is
mhm,
good for them. We can be that level of support, and I get the word I'm looking for, like just be able to open that conversation so that they're having that conversation with their parents. Because a lot of times they won't have that conversation
mhm.
until it's too late, like you said. Now
And I
you've
and
worked.
I and I always encourage people to put together that care team, and whether you're a key element of that, whether it's financial or legal or health or housing, it all has to come together. Uh, as you know, unfortunately, if people don't take care of their financial and or physical health, that it's they're going to get sick or burned out or worse.
The solutions today are again are not the same as they were 30 years ago. It's not just a one policy. It is there's multiple ways to protect your future aging in place or going into a memory care facility, or protecting your family so that they don't have to take care of you when you're having those moments where you don't want your child seeing you that way. So
Mm-hmm.
there's so many ways, but a lot of times this kind of family incident can cause conflict. And, if the family is spread apart, because long ago when you would age in place and you would take care of your family, you were all together. Like we joked about where we grew up, it was, all the family farms were right by each other. So you could just go a mile down the road and go take care of grandpa and stop in and see them. So what role can an advisor play in helping clients navigate the family dynamics? Not that we are a therapist or we're paid, that's our strength, but sometimes being able to foster communication helps with that family dynamic. What can we do better?
So I think it's being aware of what the options are that will help people through those situations. Again, a support group is helpful because you're hearing from others what they're going through and they get some ideas. The best ideas come from the other caregivers. And we, in my groups, are not specialized in terms of like adult children only, women only. It's all ages, all genders, all relationships, all types and stages of dementia. And then also being aware of people who can provide the support in terms of therapy or counseling. And then some families are so bad, they can't decide on ordering pizza. They're in conflict, let alone caring for their loved one. So it's being aware that there are options like an elder mediator who can help the family come to an agreement when they're in an impasse, keep them talking, and find a solution that everybody can agree upon. Very quick story. I had about a 2-year client who was originally from the Portland area, but was living in the UK. Her mom and stepfather were in big buy-in, high-rise, beautiful care communities. But the mom, because she was being neglected by various aspects, family, the care community, her own doctor, she was in memory care. She shouldn't have been. She just didn't get the right attention. We ended up doing kind of a combination of a care conference and a mediation with all the affected parties and came to some solutions, an agreement that everybody could live with and to get the mom back on track. One of them was that she needed B12 shots, which her own doctor didn't believe in. And she was immediately, and I had a house call physician go in and see her, give her the B12 shots, assess her, diagnose her, and she ended up back with her husband in independent living. So that could have been avoided, but by putting together a care conference and my being in a neutral position, not making the decision for them, but helping them arrive at it. And, can you imagine how the UK client, the daughter, felt having eyes and ears and a team here in Portland? She had enough stress and having to make enough travel and expenses without our team. So, it was very worthwhile for her, very reassuring.
Now, Bill, because my brain is just going a million miles a minute because I've experienced some of what you're talking about and such. And working with my advisors, I always look for ways to support them because at the end of the day, their clients are, if their client experience is great, they're happy advisors and have happy clients. But what services can our advisors leverage through your organization? Are they able to leverage your organization to help their clients develop their own care plan? Are we able to leverage you?
So I think it's knowing that the caregivers won't take care of themselves as well as they should. They try to do it all by themselves, all at once, instead of taking almost like a triage approach, is tell them they don't have to go it alone. There are resources, there are advisors in all aspects of your journey that can help you get through that horrible time period. And so it's going to be difficult. We know that it's the words that usually come to mind with caregivers. It's exhausting. It's overwhelming. It's isolating. It's stressful. It's harmful to your health financially and physically. So we want to put together that care team and give them that support that they need.
How do my advisors get in touch with you if they want to add you to their toolkit?
Yep. So the best way is my website, Cohen, Cohen, caregivingsupport.com. And that's my website. It has how I work, how I get paid, how to schedule with me, also about my elder mediation, about speaking at groups. So yeah, pretty much a one-stop shop. And I'm on social media as well.
I know, I follow you. I get a lot of good advice from, we're in the same area, but I still get advice from you on social because it is so powerful. So thank you for
Mhm.
sharing that.
Mhm.
As we're wrapping up our time together, you had shared something at the beginning. You were at a meeting in Tualatin and you asked a question. And do you want to share that story for our listeners? Because this, I think, will help people understand why asking questions is so important.
Mhm. And this is not just because we have such an aging population, but I was at a networking meeting the other day, did a little quick talk about the walk to end Alzheimer's, which happened this past Saturday. That's the purple flower back there, as a son of a woman who had Alzheimer's. And that's a picture of my mom and me when she was in memory care. But I asked the group, how many of you either are or have been a caregiver, or you know somebody who is one or has one? And almost every hand was raised, which is incredible. And that's what usually happens, at least about 2/3. And that's eye opening, mind boggling, and scary. As our population ages, more and more, we're living longer. I mean, age is not the only risk factor. Genetics are not just the big one. It's lifestyle, it's environment. All these things are important. A lot of it is helpful to slow the progression, can be preventative. So it's important to educate yourself, inform, and that was why I asked that question. People know I need to look into this. I need to be better prepared.
It's not a matter of if they're going to be affected by the situation, it's when, because we are all going to be affected in some way. It might not be our spouse or our parent, but somebody we know or love.
Mm-hmm.
So is there any last piece of advice you'd like to give to our advisors helping clients for preparing for the journey of being a caregiver or a care supervisor?
I think just go back to the look at the big picture, and that it's not just about your investments, not just about your insurance, uh, but, uh, but to look at the whole uh, spectrum of all the tools that you could use, or you should be asking about legally, financially, housing, et cetera. Are you making any changes? But going back to inform yourself, go to the Alzheimer's Association, go to presentations. There's always things in your local senior centers, AARP, Alzheimer's Association, all kinds of groups. So, yeah, learn as much as you can and be prepared. Don't go into denial like I did and
We have to
other
go through
people
the
did.
7 stages of the grieving process when this happens. So it's okay
Yeah.
to go into denial, but don't stay there. Find your
Mhm.
peace and find your solution. And Bill, it's always so great to see you and talk with you.
Likewise.
I appreciate this, the experience that you bring. And I'm getting a little misty eyed because you've helped me so much navigate a long distance memory journey and in this project, this process. So
Glad to help.
thank you so much for being here. And to our listening audience, reach out to Bill if you want to grow your own caregiving team and help your clients. Thank you, Bill, for being here.
My pleasure.
Thanks for tuning in to the Bucket Plan on Demand, brought to you by C2P, an organization whose purpose is to educate, train, grow, and support holistic financial advisors so families can achieve true prosperity. Subscribe today for the latest episodes and insights. Visit c2penterprises.com to learn how we can help support and enhance your advisory business. At the time of delivery and any subsequent publishing, information was deemed reliable, but is subject to change by the time of listening or viewing. The contents of this piece include options and projections of C2P, are subject to change, and are for informational purposes only. The information provided in this presentation is not intended to be individual investment, tax, or legal advice.